Right.
Not all the
Right.
patients
Yeah,
who
all
are
the
coming.
participants are requested that keep mute yourself, keep muted yourself. So, Dr. Pankaj, you can unmute. I have muted all. So, please don't unmute yourself. Yes, Dr. Pankaj, please.
Yeah, yeah.
Dr. Pankaj Prashar, kindly keep admitting the new participants if it is convenient to you.
Okay.
Yes,
Shall I
Dr.
admit from my
Pankaj
side?
Nimje, yes, you can start. You can start.
Yeah.
You just, no, I'm not asking you. I'm asking Dr. Pankaj Prashar, who is Chandigarh State Branch President, to
Okay.
keep helping you. Just concentrate on your presentation. Dr. Pankaj
Okay.
Nimje. Yeah,
Okay, sir.
Nimje.
So I have very limited time, so I have to finish my case in the 20 minutes. So I trying to finish it as early as possible.
Yes, yes,
The
please.
Yeah, the main topic is the belongs to a psychiatry. The psychiatric cases are might be some doctors found it very difficult. Some newly practitioners found it very difficult to handle, because most of the time what happened, there are the problem or difficulty in the diagnosis, because most of the time patient comes to you with a certain group of symptoms, barabar? And you are sometimes unable to diagnose it, or we are sometimes misdiagnose it. So that if our diagnosis is wrong, then our approach, and when we follow form the totality, that will be defective, or that will be misleading, that cause the wrong prescription. And there might be a result will be a misleading, right? So I'm trying to focus how the observation is important in the psychiatric case and in the homeopathic practice. I am also requesting all the participants to please be alert. I am showing you the video of the girl. Please don't record the other members, so that the privacy will be maintained, right? So this is the 18 years girls who comes from the Umred, residing at Umred near the Nagpur, entered in my OPD clinic holding by her mother and the aunt, because she was not able to walk properly because of the severe weakness and prostration. The complaint was severe and constant vomiting and retching with the abdominal pain, and there was a constant involuntary protrusion of the tongue. The vomiting immediately after eating and after drinking. And there was a constant, because whatever in the stomach that was emptied by constant vomiting, now there is a constant retching is there. There is a retching with the severe weakness. Now it is important, because every doctors have their receptionist sitting outside on the receptionist table. So sometimes we need to understand the observation by the receptionist. Now, most of the time, especially in the psychiatric cases, I always ask the receptionist to tell or to share their observation. So in this case, my receptionist observed that the patient need a support while sitting and walking. There was an involuntary constant protrusion of tongue, and once there was an involuntary smile without cause, and the involuntary motion of hand twist and turn backwards, right? I am playing the video, try to understand and try to interpret through the video, because there is a very less data in order to prescribe. So we have to be rely on the observation. It is all visualized to all. I am playing the video in the Marathi, but try to see the body language, postures, and the way the patient behaving.
काय झालं ग तुला? व्यवस्थित काय ते मागे?
हो, आता 2 दिवस मागे तुम्ही नव्हते
जास्त
आणलं
बिघडलं
होतं.
का?
जास्त बिघडलं.
तुम्हाला पेशन्स नाही. थोडं येऊ द्यायचं होतं मला, मी बाहेर होतो ना 2 दिवस,
तेव्हा
एकदा दाखवून द्यायचं.
आता 2 दिवस मागे तुम्ही नव्हते
जास्त
आणलं
बिघडलं
होतं.
का?
जास्त बिघडलं.
तुम्हाला पेशन्स नाही. ठीक आहे, तुम्ही बसा शांत. काय झालं इकडे?
बरं का?
काय झालं तू सांग. जीभ बाहेर येत आहे.
There was a constant protrusion which the patient can't able to hold inside. It is an involuntary process, and
आणखी
with
काय
there was a
होतंय?
retching.
ये. आणखी काय होत आहे?
बरोबर सांग काय काय होते तर.
नाही, मला आता सांगा इथून जसं काय झालं त्याच्यानंतर 5-6 मी मागच्या आठवड्यात औषध दिलं होतं, त्याच्यानंतर काय झालं, कुठं नेलं आणि काय काय झालं ते स्टोरी सांगा मला थोडीशी. इकडे उभे राहा वाटल्यास.
तिला नाही का म्हणजे जॉब सुरू होतो त्याच्यानंतर तिला गॅप पडली ना, ते मध्ये घरी राहिली बस, बाकी तिथे तेवढा पिरियड काही झालं नाही, पण ते फक्त घरीच राहत होती, त्याच्यामुळे ते काय ते विचार करत
तसं
होती
नाही
काय
म्हणत
ते
आहे,
परिस्थिती
मी
बाकी.
औषध दिलेलं
माझं
मागच्या
video
वेळेस,
is
आराम
wrong.
नाही झाला.
हा.
त्याच्यानंतर तुम्ही आता या आठवड्याभर काय केलं?
आठवडाभर ते एक पहिले काय हे आपल्या सुतवणे मॅडम आहे दत्तवाडीला, म्हटलं आपण लेडीज डॉक्टरला
खरं
दाखवून
सांगा,
दिलं.
जे आहे ते लपून
तर त्यांच्याकडे
ठेवायचं.
नेला आम्ही, तर त्यांना रिपोर्ट दाखवला, तर त्या म्हणाल्या तो इतकं जास्त कंटिन्यू आहे म्हणे, हे काही प्रॉब्लेम नाही म्हणे हिचा म्हणे, तर पोटाचं काहीतरी असेल म्हणे, तर मग आम्हाला धनतोलीचा ॲड्रेस दिला होता. परांजपे डॉक्टर म्हणून आहे, लोकमत स्क्वेअरमध्ये वाटते ना, तो तिथे पाठवलं होतं आम्हाला, तर मग त्यांच्याकडे गेलो, तर त्यांनी सगळ्या रिपोर्ट बघितल्या, तिलाही बघितलं, पोट बघितलं, बीपी बघितलं, सगळं नॉर्मल होतं, तर सगळं व्यवस्थित आहे म्हणे, हिला काही झालेलं नाही आहे म्हणे, तर तुम्ही ठेवा म्हणे 24 तासासाठी, 1 दिवस तरी ठेवायचं असेल तरी तर ऍडमिट ठेवा म्हणे, हे म्हणजे लो झालेला आहे म्हणे, खूप आवश्यकतापणा उलटा करू सलाईन वगैरे लावू म्हणे आपण, बस. बाकी मग मी म्हटलं आता किती, आणि लिक्विड दिलं, जसं हे राहते ना ज्यूस, ते दिलं, आता चोकाळी काढते, काही होत नाही. ते डबा
आणि तिकडनं
डबा पॉलिथिन घ्या, तसं आपण डबा गाडीमध्ये आहे, हा मानते आता, तोपर्यंत अशी सरक्या. तर तिला ते ज्यूस दिलं ना, तेही पचलं, फक्त ती ओकाळी काढते.
तुम्ही लता मंगेशकर मध्ये नेलं होतं म्हणे.
हो, पहाटे
ऍडमिट केलं
काहीच
होतं?
नाही, 2-3 तास. त्यांनी म्हटलं इथं सगळं प्रायव्हेट झालेलं आहे म्हणे, तर तुम्हाला सगळं टेस्ट जे तुम्ही दाखवता म्हणे ते सगळं करावं लागेल म्हणे. तर मग यांचं म्हणणं झालं आपण इथे जर टेस्ट तिथे करायचंच आहे आणि सगळे लोक ते सायकोलॉजीवाला सांगत आहे, तर मग त्या हॉस्पिटलला नेऊ, इथे न करता बा, तिथे सलाईन वगैरे लावलं तिला, तर तेवढं पुरतं उलटी पण झाली, मग घरी आणलं, थोडंसं लेटली ते अर्धा 1 तास, मग पुन्हा कंटिन्यू उलट्या सुरू झाल्या, म्हणून मग आम्ही तिला ट्रीटमेंटमध्ये ॲडमिट केलं सकाळी नाही. तर तिथे
असंच सोडून द्यायचं का ग?
नाही होत आहे उलटी,
नाही होत.
उलटी होतच नाही.
तर जीभ बाहेर येते तुझी, जाऊ दे. नाही अशी अंदर टाक जीभ, टाक अंदर.
ते म्हणाले ही अशी तोंडाने खात नाही, तर आपण नळ्या टाकू म्हणे आणि तिला 1 दिवस वरती ठेवू म्हणे, ती नाही म्हणे, नाही राहत म्हणे. म्हणून मग आम्ही म्हटलं तरी आता 2 दिवसात फरक नाही पडला तर काय मग. बोल त्यांना बोलायचं तुझ्यासोबत, बोल व्यवस्थित, काय काय बोलायचं होत आहे तुला, अजून काय होत आहे, अजून मळमळ वगैरे, अजून काय होत आहे, डोकं वगैरे दुखत आहे, बोल तोंडाने बोल ना, मी जेवढी बोलत आहे माझ्यापेक्षा जास्त बोल, तेव्हाच समजेल ना त्यांना. बोलत नाही तू, पोट आता पण दुखत आहे का, मग अशी दुखत होतं ना, आता दुखत आहे का,
काही
खाऊसं वाटते का तुला?
But the patient is not able to tell much. She is constantly protruding. There was nausea. There was a retching. Right?
गिळत जा थोडंसं, तुला बाहेर टाकायची सवय पडली आहे ना, अंदर गिळत जा, पाणी देऊ द्यायला थोडं प्यायला.
उलटी करेल बाहेर.
when I asked about whether you want medicine or not, the patient refused. She so told that she don't want by uh, shaking the neck, shaking the head, right? So if you see the journey, because the patient comes to me after the lot of showing to lot of doctors, right from the general physician, then gynecologist, then uh, gastroenterologist, and then last at the psychiatrist. She was admitted to psychiatric hospital for 2 to 3 days, but even after giving the antipsychotic drugs, right, the patient was not able to come out of the this state. Her state becomes worse because before that there was only the retching, constant nausea, and now patient present with the protrusion of the tongue or constant protruding tongue, involuntary motion of hand, right? So some neurological complaints are developing, whether that neurological was functional neurological, not a pathological neurological, right? So in 5/9/2020, he was admitted in the Kasturba and even taken the uh, advice from the psychiatrist. The psychiatric treatment was uh, given there, right? Then shown to gastroenterologist, all the investigation, endoscopy, CT scan, all done, but there was nothing comes out. So the finally doctor tell कि भाई ये gastritis है, ये acute gastroenteritis है, like that. Then gynecologist, then MD medicine, then even psychiatrist. The treatment hospital in the Nagpur, right, was admitted and again readmitted after 2 days and was comes out of that hospital with the DAMA, discharge against the medical advice, because there was no progress. The patient itself, the doctor even don't understand, or they just written there the vomiting. The cause was question mark, right? So there was no pathological structural problem that have found in all the investigations, right? So this was the presentation. Now this itself, because when I asking deeply the cause why this happened, because in homeopathy the cause is important as far as the complaint is the recent and acute, but no significant cause was found, no history of anything outside, मतलब कुछ बाहर का खाया है या कुछ साइकोलॉजिकल या डिस्ट्रेसिंग कुछ हुआ है क्या, that was not at all, कोई भी जानकारी नहीं मिली, because the patient is not in a state to talk anything, right? Only what I have with my hand is the observation. So sometimes this happened. Only the observation is the key, that we have to enter into the totality. We have to enter through the observation and we have to find the medicine, proper medicine, because this patient goes into her parents goes into the despair. They don't understand अभी कहाँ जाए, क्योंकि सभी दरवाजे उन्होंने चेक कर लिए थे, MD मेडिसिन, गायनेकोलॉजिस्ट, साइकेट्रिस्ट, पर कहीं पे भी उनको रिलीफ नहीं मिला. So when such a cases comes to us, that are the very challenging cases. The totality, anything want to share the totality? Anything want to share the remedy? What remedy we must thought of in such a cases? Cuprum. Because any reason you want to share?
Constant protrusion of tongue.
Yeah. Yes.
Nausea, vomiting.
Yes.
Along with abdominal cramps.
Yes. Right. So cuprum is one. Anything? Anyone? The protrusion is the good observation that there was a constant, the thing that happened, which is not related to any underlying pathology.
There are some suggestions in the comment. You can, Dr. Nimje, you can go through the comments.
Yeah. The analysis of case include the disease diagnosis, miasmatic diagnosis, and the person diagnosis, right? Now we have to give first the disease diagnosis, right? So that we can go further or we can able to find out the right remedy. Without the understanding the disease, it is difficult to
Dr. Pankaj, can you please unmute yourself?
अरे unmute हो गया. Yes.
Please.
Yes. So the in the case we have to see the disease diagnosis, the miasmatic diagnosis, and person diagnosis. If you see the diagnosis, there are the lot of diagnosis comes in our mind when you see such a cases. The first is the maybe gastritis, peptic ulcer, cholecystitis, food poisoning, migraine headache, premenstrual syndrome, cyclic vomiting, medication due to medication, neurological problem, or last the psychological problem. The miasm here involved it, you can see the constant and uncontrollable, where the motor activity is losing, right? So when there is uncontrolled activity, when there is a loss of control, the miasm must be the syphilis. So it is like a hysterical behavior. So miasm must be the syphilis. Now comes to the totality. What totality could be arrive so that we can prescribe on that, which must have the syphilitic background, which must have the syphilitic load, right? So according to my observation, what I have taken that time was the protrusion, that is all delirium in. See, she behaved in a such a like in a delirium state. So I have taken not just a protruding tongue, but protruding tongue, delirium in, prostration, involuntary motion, automatic behavior, despair, and aversion to medicine. Even in that state, she not like to take the medicine. So the remedy, if you see the doctrine of signature, if you see the other features, you can easily pick out. Other than the cupromet, the remedy here first comes is the Lachesis, which comes up as a similimum, because the snake Ophidia having this type of the behavior, constantly protruding the tongue. If you see in that angle, aversion to medicine, patient is in the delirium, automatic behavior, right? All this comes under the drug Lachesis. And I prescribe the Lachesis because the patient is in the distress. Most of the time, what I did, I prescribe the medicine in the frequent interval and observe the patient itself in the clinic for 20 to 30 minutes. And I believe that if your remedy is the right, it work within a 5 minutes, 2 minutes, 10 minutes, 30 minutes. If your remedy is right. So I have to see what the remedy action is coming after prescribing or after giving her. So if 3 doses was prescribed, 10 minutes interval, and I observe, matlab 30 minutes ke baad, this is the patient video after giving the medicine. Try to understand the difference previously before medicine given and after medicine in just 30 minutes after 3 doses.
जी बाहेर नाही निघत आहे. आणखी चांगलं वाटत आहे. डोळे उघडत आहे, बघत आहे.
There was no protruding of tongue, feeling better. There was no on the retching, and now she is willing to take the medicine. Again, the changes that occur at all level.
एकट्याला सांगायचं आहे ना, बाहेर बसून देतो. तुझ्या डोक्यात, तुझ्या मनात काही आहे, गोंधळ काही सुरू आहे तुझ्याबद्दल, दुसऱ्याबद्दल नाही.
Right, so this is the video after 30 minutes of medicine itself. Now see the Lachesis given after that. Once the patient was feeling better, I have prescribed that Lachesis in 3 hourly. right? Then after 24 hours, I call the patient. Next day, the video was
अनुष्का आणि दीपिका. तिचा पेपर कालच आहे ना.
now the patient is absolutely better. There was some retching symptoms mild in the night, which again goes out, and now on the second day since morning he has taken the
आता ठीक वाटत आहे पण ताप
without any nausea, vomiting or retching.
ते
Patient
चालत आली
feels
ना आता.
better now, right? So
ठीक.
this is, you can see the shift from the disease condition to the health condition within a short period of time. So if you have the right remedy with the good observation, if you prescribe the if the simillimum is right, then we can get the result quickly, right? So even the sleep was better. Waking in morning, the patient took the khichdi in the morning without any complaints. Stool was passed, urine was normal. All the parameters, if you see, was the normal, right? So there was after 3 days, there was again the video where the patient was better. I have given for 1 week, then 2 weeks, and observed for 2 to 3 months. The patient was absolutely better, and there was no episode, such episode after the medicine was given. And continually, I prescribe her the SL only, right? So this is the case belongs to the Ophidia group, the Lachesis. The observation, where the observation is very important. Because of the lack of time, I am not going deep into the Ophidia group, right? Because one of the eminent speaker is there who is waiting for his turn. So I express my sincere gratitude to the senior most faculty of the institute, all the teachers, all my teachers, Dr. Nishikant Thape sir, Muktinder Singh sir, their constant guidance and academic leadership and invaluable contribution to the growth of this such a scientific homeopathy. I am thankful to all my, even the participant who is kindly here and understand the case. If anyone have the any doubt or query, please they can ask, or we can proceed to the further.
Dr. Nimje, the protocol is that thank you for your presentation. We'll wait till after the main presentation by Dr. Chandrasekhar sir. Then we'll keep a question answer session, and then people, you can go through the chat and prepare your answers, and or at that time we'll take answers. So I invite all the participants to type their queries into the chat box so that we can pick up from there and answer the queries, most relevant queries.
No problem.
Queries related to today's topic only.
Yeah.
Thank you, Dr. Nimje. It was a very good presentation, and due to time constraint, I can see that you have justified the presentation within given time. So now I would like to invite our main speaker of the day, Dr. Chandrashekhar Gorantla. He's a professor and Materia Medica HOD department in Guru Nanak Homoeo Medical College, Hyderabad. And it's our honor that Dr. Chandrashekhar Gorantla is also leading the Telangana state branch as a president. So we welcome Dr. Chandrashekhar Gorantla. His topic is metals in homeopathy. He is a very good presenter and very good teacher. He's running his own academy for online teachings also. So I would now like Dr. Gorantla to take over the stage. Sir, you can share your screen and let us start the presentation without taking much time. Dr. Gorantla.
So respected Dr. Muktinder sir, respected IIHP National President Dr. Shivamurthy sir, Dr. Vinod Sangwan, Dr. Barbat, International Coordinator Dr. M.A. Rao sir, Dr. Tanveer Hussain, Dr. Tape, Dr. Madhu Varanasi, Dr. M.N. Raju, and Dr. Hari Krishna, my General Secretary, and all esteemed doctors. Good evening, one and all. Today, I am going to present you the metals and its remedies. We have very less time because it's a very big topic. So this is the periodic table. So if you see the periodic table, we have seven rows and 18 columns because I'm going very short. So what is a metal? Metal is a material that is lustrous in appearance, shiny in appearance. Whenever you see a patient who is shiny in front of you, who has some type of shining in their faces, and see, they metals take electricity and heat relatively well. And what is this meaning? They take responsibility. So the responsibility they are ready for. So a metal is always positive, always lustrous. There is a shine in their face, grace in their face, and also take the responsibility. Any responsibility they are ready. And ductile and malleable. Ductile and malleable means usually in chemical language, they can be made into wires and strings or something. They are very fusible. They can made into long strings. They can make into wires. So these people basically can do anything with malleability and ductility. So when you see a patient as a body language, so they are very shiny and they take responsibility. They are ready for anything, any type of work. Responsibility, very good. Then you can call them as a metal patient. So I'm correlating a chemical quality of metal with homeopathic quality of a patient, how you can find. See this, we have many metals in homeopathy and in the periodic table. So see this. So what are the properties of metals? So just correlate with, in the language of homeopathic patient, they have lot of hardness. Metal have hardness. Hardness meaning mentally they are hard. They are strong. So in a patient language, they are strong in their presentation, in their mind as well, and ability to resist repeated stress. So if you give lot of stress also, metal patients will face the situations. So they're ready for facing the challenges. And you see this, lot of ductility, malleability, some type of adjustability, positivity will be seen in patients. So this is a simple correlation of chemical nature with the homeopathic patient's language. So these are the, see, this is a lustrous, same thing. You can see luster, shine in the face of the patient. They are very hard mentally, hard physically, malleability and ductility, a sort of adjustability. And, see, their sonority means their presence will be, for example, a Aurum patient is there, Aurum personality is there. He'll be shine not only in that particular area, complete all over the world. So that type of shiny nature will be seen. So we have conduction of heat, conduction of electricity. What is means they are ready for challenges. Any types of situation in the life they are ready to take. So these are the three types of elements in the periodic table. If you take Mendeleev's periodic table, we have so these are all metal green color. They're all semi-metals and they are non-metals. So all these are all metals. So all these are so many metals. So it's very difficult to complete this one within short time. So just I am, for our convenience sake, I have divided these metals into three. So we have, for example, you take this periodic table. This is a homeopathic periodic table where we have, seven, rows, 7 rows and 18 columns. These are all columns. So from 1 to 18, we have 7 rows. The first metal is seen in the fourth row of the periodic table. For example, all these are all scandium metallicum, titanium, vanadium, chromium, manganum, iron, cobaltum met, niccolum, cuprum met, zinc met, gallium, germanium. All these are all metals. It is in the fourth row of the periodic table. And coming to the fifth row of the periodic table, main is we have ruthenium, rhodium, technetium, all these medicines, ruthenium, rhodium, palladium, argentum, cadmium, all these are all metals in the fifth row of the periodic table. And in the sixth row of the periodic table, we have tungsten, rhenium, osmium, iridium, platina, aurum metallicum, mercury, thallium metallicum, plumbum metallicum. So the metals, important metals, are situated in the fourth row of the periodic table, fifth row of the periodic table, and sixth row of the periodic table. Let us see what are the fourth row of the periodic table metals. So the metals have to be with performance and defense. First line of metals in the periodic table concerned with the defense more than performance. So defense meaning they are more worried about what is called materialistic things. For example, health, money, job, everything. They talk more about job, they talk more about money, they talk more about their health. So this is the characteristic of fourth row metals in the periodic table. When a person talks about health, his job, only his job, not outside the job, and health, so then you can think of fourth row of the periodic table. Coming to the fifth row of the periodic table, where argentum, palladium, all medicines are situated, stannum. So here, the fifth row of the periodic table, more with the performance. So the main area of fifth row of the periodic table, especially metals, about their performance. So they want to perform, they want to do some creative work, they want to perform it. So they talk about performance, they talk about creativity, they want to do different activity. So all these metals are called skilled metals. Argentum nitrate, so palladium, all these are all skilled people. They have got some creativity, they want to perform, they want to do research, they want to have a lot of creative activity. They don't talk much about health, they don't talk about money, and they don't talk about career, as in the case of fourth row of the periodic table metals. Now here you see the performance. I want to perform, I'm doing research, and I have to perform. This type of presentation, these fifth row of the metals will do it. And sixth row is having lot of atomic number, a big atomic number and big atomic weight elements. So here they are the strongest people. And here you can see that they are called heavy metals, like osmium, iridium, platina, gold, mercury, plumbum, thallium. And they have the strongest defense and performance issues. Here, they don't talk about their career. They don't talk much about their performance. they talk about responsibility, not the responsibility of the family, like fourth row of the periodic table, fourth row elements, but they talk more about responsibility of the society, responsibility of the group. So they become lot of responsibility. That's why you see that, on the other side, they have a lot of delusions surrounded by enemies, lot of anxiety consciousness, guilty feeling, except one or two like Mercury, and they are the leaders of the society. So we can classify fourth row. They talk about fourth row metal talks about their duty, health, and money, etc., career, etc. Fifth row talks about creativity and performance, and sixth row talks about responsibility. So we can say responsibility of the society. They are the leaders of the society. So in this way, we can just briefly, we can say fourth row, fifth row, and sixth row. Okay, so this is the simple understanding of metals. I already told you we have less time. So briefly, for homeopathic purpose, I have divided these metals into three types. One are called elements like calcarea, kali, natrum, baryta, and we have a soft metals called plumbum, stannum, zinc, and we have heavy metals called aurum, argentum, platina, palladium, mercury, thallium, etc. So simply we can divide like this. Coming to the soft metals. In soft metal, you can see that same thing. There is a shininess on the face, responsibility they take, everything is common. But how to identify? This is the metal character. So once a patient is in front of us, how you can diagnose soft metal. So you can see some type of timidity inside, more timidity. Yes, type of timidity inside, timidity. But this timidity is always with positiveness. Where if you see the heavy metals, you don't see timidity. They're all courageous people when compared to soft. And heavy metals like aurum metallicum, mercury, platina, they have got a lot of domination, lot of egoistic. We don't see that type of domination, that type of egoistic nature in soft metal. Soft metals are slightly timid, but always positive. And heavy metals are very, very courageous and also positive. And you see, domination is more in heavy metals because the heavy means, they take heavy responsibility and they are heavily dominated. In that way, we can pay. So we have see this, they have, this is the major difference between a soft metal. Both are positive. One is soft, one is slightly timid, one is dominating, one is super responsible and ready to face the challenges. And soft metal reach the target with softness. Heavy metal reach the target with harshness. So this is both have some anxiety consciousness, a guilty feeling. If they don't do the things, that will cause a lot of guilty feeling. But it is more in heavy metals like aurum metallicum, etc., etc. And both are religious. But soft metals are comparatively more religious when compared to heavy metals. So we have soft metals. You see aluminum, manganum, zincum metallicum, stannum metallicum, plumbum metallicum. These are the soft metals. So all possibilities. We cannot describe all the metals. Simply, you see the alumina. So alumina is very, very glimpses of alumina. Usually, these patients are smiling in nature. Whenever you see a shininess, lusterness with smiling, first you should think of a metal, that too alumina. If she is soft, then you can think of alumina. What is important in alumina? Alumina is mild, timid, all the qualities of soft metal, loving and affectionate. What is very, very important is the main thing is about alumina is, so what is very, very important is delusion, head belongs to other. So what is meant by delusion, head belongs to others? Usually alumina parents are very, very dominating, very, very dominating. They never give chance to the patient to take the decisions. So always they will take the decisions. So what happens? This patient, alumina patient, since from the childhood, they'll become irresolution. They don't have, resolution capacity. They don't have, what is called the decision making capacity. So there is always a confusion. Irresolution, confusion. So we see many patients. I have a patient of alumina with a difficulty in swallowing, and it was named as there is a esophageal spasm, and all the doctors said it's impossible to treat. They have given the medicines, but always the swallowing difficulty will be there, especially solids, especially in the night. Afternoon she can swallow, but night time she cannot swallow. So dinner she cannot swallow. And if you see her mind, she is working as in the court. So whenever the judge dictates something fast in a hurried way, so she'll get confusion. And she cannot write what exactly the judge says. And it is very, very important what the judge dictates. It is a final verdict. So she gets a lot of confusion and asks the judge repeatedly, sir, what can you repeat like this? So there is a lot of confusion. And if you see her, childhood history, parents never gave opportunity to take the decision. So this lot of, she cannot take. She goes to the restaurant and she'll be confused what to order. She'll go to the some place and she cannot decide what to take. So that type of confusion, and very chilly. And if you see this swallowing difficult solids in the night, we have two remedies, alumina and naja. So alumina was prescribed for this patient, and patient within few months became completely all right. And she is, for the last 1.5 years, she is doing well with alumina. So alumina, the head belongs to other. What is meant by this? The head, brain will be by others. For example, husband will take the decision. Parents will take the decision. In the old age, son will take the decision. She cannot apply. If she apply, there is a confusion. She cannot take the decision. And usually, aluminas in the psychotic phase, they are smiling. But in the syphilitic phase, they cannot take the dish. They cannot smile. And you can see smiling for everything, alumina is there. Smiling never. In the syphilitic phase, alumina is there. This is the major difference. So you see that a lot of other modalities, other physical symptoms. So this is about alumina briefly. So you can see that smiling, confusion is the keynote. We have a nervous system. For example, you see this alumina has, this alumina might be a good remedy for left-handed children who have been forced to write with their right hand. So usually they wanted to write with the left hand, but parents always insisted for right hand. So they are forced to lose their identity. So left hand now became right hand because of forcing of the parents. And whether they'll be always in a confusion whether I'm left-handed, right-handed. So when you force a child to be something other than what he naturally is, you encourage the alumina. So you just go for a confusion. And confusion is the keynote of this confusion of series. So you can see that this remedy is very important for many disorders, including cerebro, CNS disorders. Okay, so they lose their identity, they lose their what is called control in the later stages. So coming to second case, so it is a case of primary infertility. Married life is 5 years, and the periods are scanty, and so after 3 years they were not conceived. So couple visited a allopathic doctor, infertility specialist, and she prescribed some medications without any success. Later, gynecologist said, so with the medication, you are not conceiving. Let us go for IUI. She went to IUI without any result. So she also underwent laparoscopy. And in the laparoscopy, she was found that she was suffering from fallopian tube tuberculosis with a bilateral tubal block. And so she underwent 9 months of anti-tubercular treatment because they believed that there was a tuberculosis. So 9 months course you have to take. She underwent treatment for 9 months for tuberculosis, and after 9 months also the tubes were not cleared. Finally, gynecologist said, okay, don't go for this, let us go for IVF. She underwent IVF. IVF also failed. This is bilateral tuber block, bilateral cornal block. So you all know that 25 to 35% of infertility patients present with tubal problems, including tubal block. She was born in village. Father was a farmer, and she is very hardworking since from the beginning. She wanted to reach the top in education. You have to identify here. So definitely she's a metal. So which row of the periodic table she belongs to? Whether she is a 4th row periodic table, 5th row of the periodic table, or 6th row of the periodic. This is very important. Very hardworking since from her primary school, and used to top her in education. She used to be top in the education. When she used to get first mark, she used to share her family members and relatives. And if they acknowledge for her achievement, she used to be happy. So she used to get first mark, and everybody should, you are the best, you are the best, you are the best. Then she used to be very happy. She wanted to join in residential school to improve her skills. So after 6th class or 5th class, 5th standard, she wanted to join the residential school for improving their skills. Everybody said, your daughter is performing very well. So this village school is not sufficient. You have to go to the best residential school. So she was a top in 10th standard. She had done a lot of hard work, but she was worried whether she would get an engineering seat or not. So after 10th standard only, she wanted to become an engineer, and she was worried about her. Because of her top marks in 10th standard, she was given a free education in one of the corporate colleges in Hyderabad. You all know that now the corporate colleges, junior colleges wanted a meritorious students. They are ready to give free education to these people. And one of the corporate college, junior college, has offered her free education because of her, almost 99% marks. So in 11th standard, she wanted to become a IITian. She achieved IIT. So after completion of 12th standard, she joined in IIT with meritorious. She secured a good rank and joined in IIT Chennai. IIT Madras, in computer engineering. So she is going from a village, from a rural background to a metro area. And in IIT also, she was always worried about her future, whether she would get good job after my graduation. See, what is very, very important is, so you can see that this personality is always worried about the career, Her method of studies were methodical. You all know that all metals belongs to mineral kingdom. Mineral kingdom people are very methodical, very systematic, very organized. So if you see this systematic, methodical, organized in a patient, you can think of mineral kingdom remedy. And if you see mineral kingdom, we have elements, metals, everything. But you know what are the features? What are the points to identify metallic people? You know that shininess, religiousness, positiveness, everything. Again, we have a soft metal and hard metal. You know the differentiation. So likewise, you have to make your own identification of metals. So her method of studies were methodical. So she belongs to mineral kingdom. She used to wake up in the morning around 5 a.m. and read and completes work. So on time, systematic, organized, methodical, fastidious, belongs to mineral kingdom. After BTech, she also completed MTech from same IIT. See the industrious nature of this particular patient. She got offers in top companies. She worked in one of the top software company for 4 years. Later, she started her own software company. So she is slowly rising from school to rising from the college, rising to her own, industry. She's quite successful in her business. She has a cordial relation with all her employees. Her decisions are good. But whenever she takes a decision, she consults all the colleagues. So if it's a business meeting, if it is a decision related to the business, she consults all the people, make a team and take the decisions. Her decision will be improved. So improving and, a group, what is called teamwork. Teamwork is very, very important for her. Good relation with her husband, not only here in the business, at the family level also, she is very good with her husband, in-laws. Husband support her, takes advices from the husband. So again, advices, cautiousness, taking the suggestions, taking the feedbacks, improving, and finally take the decision. This is a success. So this metal, when it wants to go to any place, new place, or if they want to buy any plot or any this one, they will consult all the people. They will consult a geologist for water resources. She will consult an advocate for related to any legal documents. So she will take the help of friends. She will take the help of Google. And so this is the teamwork this metal will do. And finally takes the decision. You don't see any domination. You don't see any, dictatorialness in this particular patient. It's a soft teamwork, improving, going forward. So there is a success. Okay. She's calm since childhood, don't talk much. She has a limited friends. She achieves anything, she shares all the relatives, and anything she achieves, she shares with all the people. So she needs a lot of appreciation. Anything she gets success, she discloses to all the people and everybody appreciate. She doesn't like to listen about death people who died in accident. So some sensitiveness is accidents, etc. If she hears such traumatic events, she gets disturbed and will be, that will be there lingering in the mind for a long time. Everybody likes her, though she's calm and doesn't talk much. Say metal will be liked by all the people. One or two exceptions are there, but a metallic person is always charms, always shines, always, everybody likes them. Okay. So though she is a pleasant, she is very, very calm, everybody likes her, because she is the example of hard working in their family. So this is she spends money with caution. So if you see that in the physical general, she likes milk, she's thirsty, dreams of water since from her childhood, and scanty menses only for 2 days. So in mineral kingdom remedies, sometimes you see fastidiousness in every area, including menses. Menses will be 28 days, 2 days, since from her monarchy. That is one of the point. Usually we say that arsenic menses is very fastidious. But not only that, all the metals have, perfect. If they present with, my periods are regular since from the menarche, 28 days and very 2 days. That fastidiousness is there in all the levels. So chilly patient, she had a anemia, she had a tuberculosis. So you see the totality of symptoms: calm, cautious, anxiety about future, appreciation wants, sad stories, cannot really tolerate, dreams of water, hatred for persons who have offended. There is one thing is, if anybody comments, she doesn't like them. Even, everybody has a minus point. Even a mineral also has 5% of negative quality. Here you see this patient has a negative quality, hatred for person who have offended. Okay. So menses is scanty, chilly. These are the totality of symptoms I've taken. They report a quiet disposition, cautious, anxiety about future, wants appreciation, horrible, sad stories affects her profoundly, hatred for persons who have offended her. So dreams of water, 2 days, menses scanty, chilly patient. So you see these are the repertorial chart. So these are the remedies that have come into after repatriation: pulsatilla, natrum, manganum, sulfur, silicon, axonic, veratrum, sapian. And we wanted a mineral remedy, very clear cut. Okay. So what are the mineral remedies? Mineral kingdom, because she belongs to methodical, organized, and systematic. We can see here a teamwork. Together we can achieve feeling. The theme of teamwork, together, improving, refining, reinforcement, and advice. I'm a very successful personality because I'm a team. I always believe in teamwork. Any organization, teamwork is important. So teamwork, togetherness, improving my decision. I have taken decision. I will take the suggestion. I will take the other person's decision, and I improve my decision. I refine, I reinforce, and by all the advices. So then this is called 360 degrees decision. So here you see that she wanted to grow more and move towards in the life, excel in her life. Suggestions and constructive criticisms gives them scope to improve. Very cautious. So if you see this, she's talking about more career, more business. So obviously in the periodic table, you can say that this patient belongs to 4th row of the periodic table. In the 4th row of the periodic table, so you see now repatriation of totality or repatriation result. We have a 3 mineral remedies: silicia, caligae carb, and manganum. We see the periodic table. Just go to the periodic table. This is so this is the 4th row of the periodic table. Silicia is here, calcareous carb is here. You see this. This is manganum. Manganum is very close to ferrum. So ferrum reflection will be there in the manganum always. What is the ferrum? Ferrum is, you all know that ferrum is very strong, very strong. So after manganum, ferrum. Ferrum has anemia. The reflection of ferrum will be on the manganum. Manganum also has anemia. Manganum also has anemia. So manganum people, manganum belongs to 7th column of the periodic table. You see this 1, 2, 3, 4, 5, 6. So these people always believe in improving their skills. They believe in teamwork. This is the important aspect of 7th column of the periodic table. These are the rows. These are the columns. So 7th column always wants to refine, always wants to reinforce, always wants to improve, always believe in teamwork. So you see this. Now, I really wonder whether, manganum, see this. If you see the manganum, it was proved by Dr. Hahnemann. Manganum aceticum, basically. We have manganum metallicum, but manganum aceticum is more popular, proved by Dr. Hahnemann. So manganum main mentality is quite cautiousness, reservedness. Okay, you all know that calcarea carb is timid, anxious, cannot take decisions, insecurity. But here there is no insecurity. Insecurity, everything is element, calcarea, metal, positive. I can do it. I will do it with teamwork. So I prescribed manganum. Manganum 30. So these are the SL. After 9 months, feeling better. Even cycle for the first time after 3 months, it became normal, not two days scanty. It became 3 days regular. So after 9 months, feeling better. And after 10 months, I did hysterosalpingogram, and hysterosalpingogram showed normal study. Both the bilateral blocks are cleared. So now, after 11th month, pregnancy positive. So this is the, report, antenatal checkup report. So she was blessed with baby boy, and this was the, this infertility clinic. See, I had, it was written by her, endometrial tuberculosis, and she went for different treatments, and some of my friend suggested Dr. Chandrasekhar, treating for a year. Things started becoming positive. My SHG went through the SHG. The results were positive. There were no blockage found in both the tubes. After a few months, I became pregnant, but our joy knew no bounds. So he gave us hope when we had lost it. So this is the manganum acetic. So in chronic diseases of Dr. Hahnemann has written menses too early, 6 days, scanty, lasting for 2 days. The difference between ferrum and ferrum manganum, both are neighbors. Manganum has a scanty menses. Ferrum has too early, too profuse, too prolonged menses. Okay, so I don't want to say more this. You all know that. So this is about we have more things. Soft metals, we have a plumbum, we have stannum. Stannum have weakness. Stannum has weakness. Stannum, lustrous personality, too much responsibility of the family, became so weak, and finally they will come with emptiness, weakness at all levels, especially in the chest. So she cannot walk, she cannot sit, she cannot talk, and there is complete weakness, as if nothing is there in the chest. So that is stannum metallic. Stannum metallicum is a very important remedy for lung problems and CNS problems. You all know that sweetest taste of sputum, easy coming out of sputum, expectoration, but there is lot of weakness, lot of weakness. She cannot walk, she cannot talk. Such weakness mostly arises from the chest. So too much responsibility. The shiny woman became tired. Weakness. We have a plumbum metallicum. Plumbum metallicum is a very important remedy. So I tell you a very important rubric, the delusion of plumbum metallicum. Delusion, ordinary business she's doing. So plumbum metallicum always wants a specialist doctor. Specialist doctor. What is meant by specialist doctor? The doctor who can really go into the root of the problem and try to prescribe. So they don't want ordinary doctors. Even while your treatment, they will ask you, sir, I'm not getting relief. I'm not getting relief. So can you suggest a best doctor, a super specialist doctor for my complaint, my knee pain, right-sided knee pain? So they don't want ordinary business. They want to have a specialized business. So delusion, ordinary business. So if you see such personality, usually right-sided, constipated, slow, and you can see, plumbum, a lane. If you want to see, you can see on the gums. This is plumbum metal. Now let us go for heavy metals. I told you, very hardworking leaders, go-getters, achievers in life, dominating dictatorial heart. These are the heavy metals. Religious, okay, serious people, not very emotional. Soft metal can be emotional, but they are not. Examples: ferrum, cuprum, argentum, palladium, platina, aurum, thallium. So here, see this very simple case. We don't have much time. This is a case of a 46 years old lady presented with the following complaints: irregular cycles for the last 2 years, menopausal almost, bleeding heavy, lasts for 10 days, heavy and bright red. She consulted a gynecologist and she did ultrasound pelvis. So gynecologist said, you go for ultrasound. So ultrasound shows, see this, 2005 January. So there were a lot of fibroids. See, 3.5 into 2, 1.3 into 3, 6 point into all these things, 1 point into 1 point. So there are so many fibroids. So many fibroids. So ultrasound reveals fibroids in the uterus. She consulted super specialty. So immediately she went to a super specialty hospital. Again, they did the ultrasound. So this ultrasound shows, see this. See, this shows, 19.70 mm, 17 mm anterior wall, 22 into 20, 17 and 16, 30 into 18, 13 into 11, all this in 14 into 12. And also now she's, having what is called uterine polyp also. See this, multiple fibroids, endometrial polyp, adenomyosis. They wanted to go for polypectomy, if you want hysterectomy as well. But she said, I cannot do it now because I'm busy. So all these things. There are many fibroids and uterine polyp. They advise polypectomy. Also think of hysterectomy because she had a heavy periods and she was getting anemia. As she is a district educational officer and examinations, it was in the February or somewhere, 2025. So examinations are all there in the March and April. She said, it's not possible. I will not go for surgery right now. So she came to me, district educational officer, hardworking, very simple. I'm explaining you, wants to have quality education. She believes in quality education. Always wants to have moral education, no copying, no malpractices. She visits all the schools and motivates teachers and students. She will tell everything good, positive, honest and punctual in the work. So very honest. She is the eldest of her family, second side of her coin. 5 siblings. Father expired when her age was 22 years. Later, she took responsibility and settled all the siblings. So she joined in the school at the age of 23 years. Government teacher, and she has just now a district educational officer, and she's very spiritual and donates for temples. She take care of her 3 children as well. Third side of the coin. So husband is very calm, doesn't involve. She takes care of her children. She tells to be moralistic. If you do mistake, I will be responsible. So this is very, very important. Self-blaming. Whatever she tells, they have to listen. She's very dominating. Lot of responsibility. So very simple case. Desire for sweet, heart patient. So analysis was responsibility unusual, responsibility at the level of work, responsibility at the level of siblings, responsibility at the level of her family. So what is called super responsible. Morals. If you do wrong, I am responsible. Self-blame. Blame game. Dominating religious heart. Obviously, if you repertorize, Aurum metallicum will be there. But if you see the boric Materia Medica, whenever you see Aurum type of personality, because Aurum metallicum is chilly, now it is hot. Whenever you see a Aurum personality with uterine pathology, cancer pathology, so the remedy is Aurum your net. So this was a remedy prescribed by me in May 2025, and after 3 months, cycle became regular. 3 days normal cycle, and the recent ultrasound shows they vary 2 fibroids only. All polyps have gone, multiple fibroids, everything gone. Only we have a 16x20 and 19x20 small fibroids. So polyp gone, all big fibroids, centimeters have gone. Now 2 small fibroids are there. Now she attained menopause. I think she's much better with Aurum urinate trend. What is the indication? It is a heavy metal dominating. So dominating and huge responsibility. So these are the indications for this particular, Aurum urinate trend. Okay, Aurum metallica. Let us see another case. It is a case of 1 minute. Usually it is a very simple case, basically. Very simple case. So this is a case of 55 years old lady presented with hair loss for the last 8 months. She lost her hair gradually. 1 year back, she suffered from pneumonia. She was admitted in the super specialty hospital in Hyderabad. After the treatment, she was not recovered for 5 months. She had a lot of cough and weakness in spite of the medication. It had taken 7 to 8 months for the recovery. After that, she started losing hair. So this is she also suffering from trigeminal neuralgia. She gets severe pain on the right side of the face. During pain, she screams, terrible pain. She screams, very severe pain. So my remedy should have 2 things. One is hair loss. One is action on the nerves. The reaction of the, this nerve pain is a screaming, terrible pain. This is very important. Now see this. This is aging. Nothing can be done. See this. She is metallic face. Metallic face. You know? So say this complete loss. Somebody said it is alopecia areata. Somebody said no, it is aging. You won't get it. It is a female pattern baldness. Whatever it may be. So we have to give the treatment, whether homeopathy works or not. So good appetite, constipation, chilly patient. She's outgoing and extroverted. She works for the children and women rights. So she is, injustice intolerable. She's working in one organization. That organization main motto is women's rights and children's rights. If anything wrong happens, she will react and questions. So this is, this is the quality of this metal. Causticum like injustice intolerable. Causticum is also like a metal. Okay. So don't give just causticum. See the case. See the case. Form a totality. Understand the miasm. Take a totality. Go to the repertory. It is not a simple case. It's a syphilitic case. So you have to use all the tools to come to the simile. She believes in God and visits temples. So this. You see this grace appearance, shiny appearance. You have seen her. So directly ask and works for the, what is called women rights, children rights. So leader, come to 6th row of the periodic table. Last case also we have come to 6th row where Aurum is there, gold is there. So we have given Aurum movement. Here also same thing. You see this. So much of activity, so much of courage. Very positive. Can face the situations without fear. There is no timidity inside. This is all about courage. This is all about responsibility. This is all about guts. This is all about losing the hair. So you have to see PPP. What is meant by PPP? Not PowerPoint presentation. Psyche, physicals, pathology. Psyche means mental. Physicals means physical generals. P means pathology. So you have to match this PPP. Then only positive, another fourth P will come, that is positivity. Okay, see this rubrics. So any syphilitic case, any hard case, you have to work out. You have to work out. If it is a soro-psychotic, then you can go with our experience. When it comes to syphilitic, you have to use all the tools to complete your task. That is simile. See now, injustice cannot support. Religious affections, scream during pain. That is very, very important. That's something syphilitic. She screams. Injustice cannot support, just like caustica. Just like Staphylococcus aureus, but Staphylococcus aureus suppress. Causticum, right-sided hemiplegia. Now the pathology is hair. Can we give causticum? We have any pathology related to hair? That is question mark. Hair fall after diseases. There is one rubric. Very interesting. So the result is calcarea cup, belladonna, sulfur, zinc, sepia, thallium. We have two remedies from metals. One is zincum metallicum, one is thallium metallicum. But thallium metallicum, zincum. Zincum is very important for immunity. Zincum is very important for hair. You might have seen doctors are prescribing some Ginkgovit or something during Corona time. So zincum is for immunity, zincum is for hair. But zincum is soft metal. So thallium, So see this. See this? Oh, okay. So thallium is there in the 6th row of the periodic table. 6th row is the periodic table. See this. So see, I went to a literature, Thallium metallicum. Thallium seems to be influence the endocrines, especially thyroid and adrenaline. Most horrible neuralgic spasmodic shooting pains. Terrible pains are the characteristic feature of thallium metallic. Though metal, they scream with the pain. Terrible pain is the characteristic of thallium. Causticum will not scream with the pain. They bear. But here there is a screaming. Muscular atrophy of tremors, relieves the violent locomotor ataxia, paralysis of lower limbs, alopecia following acute exhausting diseases. See the pathology, night sweats, polyneuritis, etc. See this. The keynotes of this remedy is pains are cutting, lancinating, and other things. Endocrines are horrible pains, constipation, alopecia after exhausting diseases. So we have see this. This is the importance of all leaders. Delusions. You see, Mexol, Thallium, other remedies. Surrounded by enemies, murdered being, somebody is pursuing them. So you see this. This is a rubric. Pathology. I told you, psyche, physicals, and pathology. You see the pathology. I've taken from the complete repertory. 20 remedies are there. Head falling out, alopecia diseases, calcarea, ferrum, mancinella, thallium sulfan, thallium met. So thallium is given, thallium and its compound is given in 2 remedies are there. So this is thallium met. So thallium metallicum 203 doses were, and waited for many months. All after a year. There is a full, hair has come up. She is aged about 55 years. She was suffering from almost alopecia, and or female pattern baldness. Somebody said female pattern disease. After thallium met, complete hair was restored. So this is the, way in all syphilitic and difficult cases, we have to sit, we have to work out, identify the miasm, identify PPP axis, and try to prescribe remedy for beautiful results. Okay, so in this way, I have made a small presentation on metals. So elements, metals are soft and hard metals. How to prescribe for soft. I've also told 4th row, 5th row, 6th row, and I have showed you 3 cases too. So any question you can ask.
Thank you, Dr. Chandrasekhar. You have a unique way of presenting the difficult subject with so much ease. So you are most welcome. So I would now like you to type the questions so that we have 15 minutes time for question answer for both the presentations by Dr. Nimje and Dr. Chandrasekhar Rao. So any questions, Dr. Rao, you can, Dr. Chandrasekhar, you can read the chat and give the question answers as per your convenient. So same is with, before we go further with the, I would like you to answer the questions. Shall I read the questions or you'll read it by you?
1 minute, sir. Come out of this. So, yeah, 1 minute, sir. Can you help, sir? Can you help
Yes,
and
yes.
ask some questions?
Yes, I'm also reading.
Yeah.
I won't think there is a relevant question.
There is no question for Chandrasekhar sir. The question that asked to me, is it audible?
Yes, Dr.
Yes.
Pankaj, please continue.
Regarding my presentation, someone asked why the Lachesis is only thought of. Why not other Ophidia group? Right? So if you see my entry point was the protruding tongue, and if you see the repertory, if you refer the repertory, the rubric given is the protruding tongue delirium in, because the patient was in a delirium state. Now, what is the delirium? The delirium is the irrelevant, wild, puzzled state. It itself defines the derailed state. So I have taken the delirium with protruding tongue. If you see that, there is only two remedies which belongs to a Ophidia group, that is the Lachesis and Vipera. Now I have the two choice, the Lachesis and Vipera. The other remedies are ruled out. Now, if you see the another rubric which is belongs to a syphilitic miasm, that is the patient was not willing to take medicine. Now this is might be because of the despair कि ये hospital में गई, वो hospital में गए, इसको भी दिखाया, उनको भी दिखाया. There was a lot of medicine, injection, intravenous IV fluid. The patient was in a state कि नहीं, अभी कुछ नहीं लेना है. So I have taken the despair state as well as the aversion to medicine, and that was solely present in the Lachesis. If you see the two remedies, Vipera and Lachesis, right? And there was also some behavioral symptoms like automatic behavior and all this, which is exclusively present in the Lachesis, which rule out the other remedies in the Ophidia. So finally, I have come to the Lachesis. And if the Lachesis, the most similar remedies or a differential remedies with the Lachesis is the Vipera, right? So I think another participant asked about the why not mercury. I don't think that any symptoms belongs to a mercury. If the doctors highlighting the why he thought of the mercury, then I can answer further, right?
Dr. Nimje, in Lachesis, we also have one symptom, that inability to protrude the tongue. Paralysis of tongue, inability to protrude. So this is very contrasting, that in this state, we have seen that syphilitic, but most of the psychotic cases, we see when we ask to the patient to show the tongue, most of the Lachesis patient, their tongue trembles and they don't protrude it properly.
Yeah, that was in the pathological state of the brain pathology. But this is the purely psychological state, and I'm not discuss about the diagnosis. If you see the diagnosis, this patient comes under the somatoform disease. Now there are in the somatoform disease, there are the different subtypes, like a somatization, like a convergent disorder, like a body dysmorphic disorder, right? Malingering, factitious, like this. But if you see the protruding tongue belongs to a neurological symptoms, and there are only two differential diagnosis like a somatization and the convergent disorder. So if you clearly and finely understand the phenomena, you can easily come to the convergent disorder. So the final diagnosis was the convergent disorder. There are someone might be confused with the convulsion. The convulsion is the different, which is the pathological, and conversion is the psychological state, right?
Dr. Nimje, there's a question also about the repetition of Lachesis, if you can address that.
Yeah, repetition, because in my practice, in my clinical experience, whenever there is an acute state, when the such a patient is in the distressing state, I always repeat the dose. It is not like that ki single dose de diya or then wait and watch for a 2 hours, for a days or hours. I have to see if our remedy is right. So you can prescribe the remedy in the frequent dose and see the result in a short period of time. So in that case, you can repeat in the acute state. If I have prescribed the remedy for as a constitutional in the chronic condition, then I will always try to give the single dose.
Thank you, Dr. Nimje. Dr. Rao, now I think there are, Dr. Chandrasekhar, there are certain questions for you right now.
Okay.
There's a last question that in Rao sir case, Sahaj Leen Kaur, Dr. Sahaj Leen Kaur is asking, given Manganum, the girl wanted to study further and improve and perform. So she should belong to fifth row.
No. This is not about in fifth row of the periodic table, we have creativity. So creativity, for example, a research people, a scientist, usually fifth row of the periodic table say that I want to become a scientist. I want to do research. So they want to do research, they want to do research work, they want to do scientific work, and they have to perform in that particular work. But here is all about the career. Here is all about business. She's pakka businessman, woman. So that's why the fourth row of the periodic table comes up. Actually, this theme of periodic table takes a lot of time, but
Yes, it is very
I'm
short
telling
time. But
short
good
time,
question asked. Yeah, there is another question, Dr. Chandrasekhar, that argentum mat or argentum nitricum cases, what should be the chief feature we should know, we should be looking for?
Argentum metallicum is, they want to perform. So argentum people always usually in periodic table, they are more creative. So they can tackle any situation. So they are called what is called any problem they can tackle with their ideas. So argentum people usually they want to perform that particular scientific work or literary work. And very, very important about this is they're skilled people, and very important is time punctuality. So argentum metallicum usually will have a cartilage problems, joint problems, and also voice problems. So usually their voice is hoarse because they are good anchors. They are very good in presentations. So they want to perform. So argentum is in the periodic language. So they want to perform that particular with creativity. So creativity and performance will be key for argentum. At the same time, argentum people is very, they are very time punctual. They're having a lot of anticipation. So manganum doesn't have that anticipation. So anticipation is hallmark of argentum nitricum. But they are crisis managers. This is very, very important. Any crisis, because they have a skilled mind, all the crisis will be tackled without any problem. This is about argentum. So argentum will be the, for a leader, they will be a personal secretary, IAS officer who can, give their talent, who can give the ideas. So the personal secretary or personal assistant, whatever to the, big leaders, they'll be very punctual. They will reach the that particular office before time. They will have a lot of planning, and they will give good suggestion to the particular leader, maybe CM, PM, whatever it might, whoever it might. So argentum is that particular area. Argentum nitricum will have some problem. So after retirement, argentum nitricum usually will have a neglected feeling by the, sons and daughters. Aurum will be aurum all the time. Argentum, after retirement, there is a feeling of, damn, everybody is neglecting me. So that feeling will be there. Otherwise, they are very punctual, very good, and crisis managers. So you all know other features. Argentum metallicum is right-sided, chilly, desire for sweet, knee problem, joint problem, cartilage problems, voice problems. Argentum nitricum, hot, left-sided. You all know that nitricum element makes them crowd aggravation, narrow places aggravation. So nitricum causes that, suffocative feeling. So argentum nitricum is hot, left-sided. Argentum metallicum is chilly, right-sided. You have to know various, remedies of argentum, not only argentum nitricum, argentum metallicum, argentum sulf. Likewise, we have studied aurum, aurum mure nitricum, aurum mure, aurum iode. So we have to know the other salts of that particular element or metal, so that your life will be very easy to proceed.
Yeah, Dr. Chandrasekhar, I have also seen in my practice also that all these remedies are lot of appreciation seeker, as palladium longing for good opinion, argentum nitricum again feeling
Yes.
with unwanted, and then this manganum at doing good deeds, and
Yes.
this platina we all know. So that also is a very important aspect of metals because they
Appreciation is
luster, so they need to
yeah,
shine.
shine. So
Can you
appreciation is
throw
very,
some
very
light
important.
on this comparative study of different appreciation seeker of different remedies, metals?
So, for example, manganum, manganum is, appreciation in their work, appreciation for their work. Now, see, in Magnum Metallicum, we have seen that the main rubric is appreciation desires. So, whatever the work, the task, the business they are doing, they needs appreciation. Manganum is all about money, business, etc., etc. But argentum nitricum performance. Argentum nitricum performance. Palladium, you know that palladium is a metal which is again shining. They need appreciation for everything, especially their dress, everything, everything. So appreciation in most of the metals are common. In platina is a highly egoistic remedy. Even in their presentation, also in front of you, they will show their ego and very, very haughty nature. They will say that you get a doubt in front of, if platina patient is in front of you, whether she came for medicine or just she wants some guidance. That type of feeling. Every word of platina shows their superiority. So platina is also, they want appreciation. But every remedy has its own other particular features. Why they needs appreciation? What are the other physical generals? What is the pathology? Everything is very important. If you see the palladium is a very important remedy for right-sided ovary. Right-sided ovary. So palladium is a right-sided remedy again. So palladium is the wears best dress, and they need appreciation. So they have lot of ego. And palladium also, when they performing in front of the stage, on the stage. So after presentation, they needs a lot of appreciation. So much of longing for appreciation. It's a 4 marks remedy for appreciation. Argentum also not like palladium, but argentum, the theme is completely different. Argentum pathology is different. Manganum is different. Manganum usually for bones, for menstrual complaints, for hoarseness of voice, again. But every remedy has, most of the remedies appreciation, we have more than 40-50 remedies, but every remedy presentation at the level of pathology, at the level of the physical generals, slightly differs. So in this way, appreciation desires, there are so many remedies. Even calcarea self also needs appreciation. Okay. So this way we can, don't only see the one particular symptom. Go for complete case, and also observe this PPP step, psyche, physicals and pathology, and try to prescribe. So in this way, you will be, a holistic homeopath. Then otherwise, if you forget something, then there is no such degree of pathology. Usually, you will not, you cannot treat such deep pathological cases. Okay, sir? Yeah.
Thank you, Dr. Chandrasekhar. So
Yes.
now, if there is, I think the question answer session is now quite sufficiently addressed. So we can now come to the conclusion of the webinar. So on behalf of IAHP committee, I thanks Dr. Chandrasekhar Rao, President IHP Telangana State Branch, and today as an academician, for sparing your valuable time. So I would be posting the certificate of that presentation very soon to both the speakers, Dr. Pankaj Nimje. You are also a very short time. I called upon both the speakers and they very gracefully accepted my invitation and my request. So
Thank you.
today it was a very great day. In the second webinar only, we had the house full. So thanks to all IIHP members and participants for encouraging scientific committee on this occasion that we have 100% participation, whatever our capacity is. Although it is very less, but still having a house full always gives a lot of sense of fulfillment and contentment that yes, our efforts are not going in vain. Although the Dr. Chandrasekhar has a lot of following. So I got many messages that we were not accommodated due to the room was full. So thank all the participants also. So I would now like to thank our seniors who have graced the occasion. Dr. M.A. Rao sir, who has joined and blessed us. Dr. Nanda Rao, Dr. Srinivas, Dr. Chandrasekhar, Dr. Santosh Kumar, Dr. Tanveer Hussain, Dr. Tape, Dr. GLN, and Dr. Sangeeta Kohli, Dr. Ramaiya, Dr. B.S. Chandok sir, and Dr. Pankaj Prashar. All these people, they have definitely uh, blessed us with their presence, and we all need to motivate more and more people. So we'll be conducting this webinars on third Sunday every month. So next February, we have already requested some senior faculty members. So all those who are working in colleges, they can send me their name and proposal for this 20-minute faculty presentation. So as you know that we have formulated this in the way that first 20 minutes are taken by faculty members for the presentation, and then our main speaker, they speak for around an hour, and then we have 15-minute question answer session. So with that, I would now take, we are already in time, so we have 5 minutes. So I would like to invite one of our senior members to unmute and thank Dr. Chandrasekhar Rao for his presentation. Dr. Chandu, kindly will you please unmute and say a few words of thanks?
Am I audible?
Yes, yes.
Good evening, everyone, and thank you, Dr. Mukunda, for giving me an opportunity to thank everybody. It was wonderful hearing Dr. Chandrasekhar and Dr. Pankaj. Both of them, they presented a valuable and a very, I would say, authentic, scientifically proven, scientifically presented cases of theirs. Dr. Chandrasekhar, your presentation was definitely, as Dr. Mukunda Singh said before, that is the teacher of teachers. Your presentation was so much. The entire audience was so much focused. At least this was for the first time. I felt that I'm so minutely focused to webinar. So the study of metals we have been through several times, but your explanation was different. It penetrated more into the brain. So I'm sure each one of the participants must have felt the same. I must thank Dr. M.A. Rao sir, our international coordinator, who made it a point to get up, wake up early in the morning in US. He is presently with his daughter there. So he made it a point to be present today and the entire whole webinar he did. So thank you very much, sir. Thank you very much, seniors, my colleagues. The list of doctors, Dr. Mukunda Reddy.
Chandok sir, your voice is
output.
breaking.
It was very
Your voice
encouraging
is
in general.
breaking.
But my appeal to all is it? My appeal to all that please forward this message to all other colleagues that these webinars now, which the scientific committee of IHPS today was the second one. These all webinars are going to be very, very special ones with very good resource persons, very good speakers, valuable speakers, I would say, and very those who would be speaking very authentically, scientifically, and presenting their cases and the research they could do. So please spread this message so that our attendance increases multifold. So with that message, thank you very much on behalf of the national body of the IHP. Sincerely thank each one of you for spending your time to be with us in this webinar. Thank you.
Thank you, Dr. Chandok sir. So I once again thank you all for attending, and thanks for the speakers for their excellent presentations and their valuable inputs to that. With that, we log off now. So thank you all. Have a nice evening, Sunday evening, weekend. So we all have hectic schedules from Monday onward. So wishing you all and your patients a great healthy journey, and IAHP as always shine and uh, always have its luster into the galaxy of homeopathy. Thank you all once again.
Thank you.
Namaskar.
Namaste.
Thank you, Dr. Chandrasekhar, once again. Thank you.
Thank you, sir. Thank you.